Hello everyone, this is Dr. Sailesh Makwana with a case of hysteroscopy performed for secondary amenorrhea in a 30-year-old patient who failed to attain her menses after undergoing DNE 4 months before the procedure. Now we started with the hysteroscopy and we proceeded without dilatation of the cervix, and we were able to see a fibrosis at the level of the internal os. Now there are high chances of forming a false tract, as you can see, if a blind dilatation is being done. Hmm. So we proceeded safely with the hysteroscopy, and we were able to see the cervical canal, and we tried to negotiated our hysteroscope through that opening, and we just increased the level of the pressure, and the adhesions got lysed by the pressure. If the adhesions are dense, we may need to use a hysteroscopic scissor. After the adhesions were released, we were able to enter the uterine cavity. And the first thing that you need to see is the presence of adhesions or synechial bands at the level of fundus or uterus. Hmm. So we saw the uterine cavity, it was normal, both the tubal ostia were normal. So we just proceeded with the checking of the anterior and posterior walls, and we proceeded back to check the cervical canal uh, for any narrowing. Now the cervical canal seemed normal, so we just moved back to the site of the fibrosis to see if there is any residual fibrosis which needed resection with the scissor. Now most of the fibrosis was lysed, so we just moved on with the dilatation of the cervix. And that was it. Hopefully the patient should get her menses soon. Thank you.